What I want to do is work a little bit with pectoralis major. This muscle is one which gives rise, when it's constricted, to being kind of round-shouldered, and that can give rise to respiratory problems, pain in the back and shoulders, and so opening this up feels incredibly good. What I'm going to do is press down and just take out the looseness in the soft tissues, and then pull a little bit, kind of giving the body an indication of how we want to create this opening, and then begin to come across this muscle, opening up the front of the chest so that the person really feels like it's like their wingspans increasing. Then when I get to the end of the rib cage, I take both hands, replace them, and then just continue to open up not only the front of the rib cage but also the front of the shoulders. You can see that her arm has laterally rotated and the whole shoulder girdle is wider now as a result. Ultimately, just like with yoga, you need a stretch, you need a change in length for the person to have a change in their posture and a change in terms of getting rid of their pain. Second thing I want to show you is addressed to three muscles here called the scalene muscles. And these lift the rib cage from above. They say they're the second most important muscles in breathing. Hard to believe that we really breathe with muscles in our neck, but we do. They pull the rib cage up, just as the diaphragm below pulls the rib cage down. So if I ask Heidi to just lift your chin up and then look to your left, and I draw my fingers across the scalene muscles, as long as I'm here, I also go around the back of the neck, which just feels really good. And then have her bring her head back. This is called in deep massage an active movement therapy because it involves her active movement, because in many cases, if you have two people working together, you're going to get an even better result. Coming across the scalenes, back, chin down, and third time lifting up, and this time I'm going to come right underneath that backbone of the skull, the occipital bone, so I'm going to be freeing the scalenes, the back of the neck, and just feels fantastic, and it really helps with respiration too. So neck pain, respiration, everything starts to change there. How's that feel, Heidi?
That's great.
All right, fantastic.